You've seen it in movies, right? Someone clutches their chest, gasps, and collapses. The hero yells, "They're having a heart attack," and starts chest compressions. But here's a shocking truth. What you just pictured might not be a heart attack at all. It could be something else entirely, a cardiac arrest. And knowing the difference isn't just trivia. It's a life-saving skill. So let's break it down. Heart attack versus cardiac arrest. They're often used interchangeably, but they are two very different medical emergencies. First up, the heart attack. Think of your heart as a house and the coronary arteries as its plumbing system, delivering oxygen-rich blood to keep the lights on. A heart attack is a plumbing problem. A clot, usually formed from plaque, gets stuck and creates a blockage in one of those pipes. The water, or in this case blood, can't get through to a part of the heart muscle. The crucial thing to remember is that during a heart attack, the heart is usually still beating. It's just that a part of it is being starved of oxygen and starting to die. Now let's talk about cardiac arrest. If a heart attack is a plumbing issue, cardiac arrest is an electrical failure. Your heart has its own internal electrical system that tells it when to contract, creating that steady lub-dub rhythm. Cardiac arrest happens when this electrical system goes haywire. The heart's rhythm either becomes chaotic and ineffective, or it just stops completely. The wiring short circuits. When this happens, the heart stops pumping blood to the brain, lungs, and other organs. This leads to a sudden loss of consciousness, no breathing and no pulse. It's an abrupt total shutdown. So plumbing versus wiring, that's the core difference. But here's where it gets a little more complex. One can absolutely trigger the other. A severe heart attack, by damaging the heart muscle, can disrupt its electrical system and cause it to spiral into cardiac arrest. It's like a major plumbing leak flooding the fuse box and causing a total blackout. And the scary part, it all starts so small. A tiny piece of plaque breaking loose, a single electrical misfire. These microscopic events can cascade into a full-blown crisis that shuts down the most vital organ in your body. Because they're different problems, their symptoms are also different. For a heart attack, the signs can be dramatic but also surprisingly subtle. You might feel that classic crushing chest pain, but you could also just feel discomfort in your jaw, neck, or arm. You might get short of breath, feel nauseous, or just experience extreme, unexplainable fatigue. The person is almost always conscious and aware that something is terribly wrong. Cardiac arrest, on the other hand, is all about speed and finality. It's sudden. One moment a person is talking, the next they've collapsed. They are unresponsive, not breathing or only gasping, and they have no pulse. There's no warning. This is where you come in. Your response is critical, and it's different for each one. If you suspect someone is having a heart attack, they're conscious but have symptoms, your job is to call 911 or your local emergency number immediately. Time is muscle. Every minute that blood flow isn't restored, more of the heart dies. But if someone suddenly collapses and is unresponsive, cardiac arrest, the clock is ticking even faster. You call for help, but then you must act. Start CPR immediately. Push hard and fast in the center of the chest. And if there's an AED, an automated external defibrillator nearby, use it. That device is designed to shock the heart's electrical system back into a normal rhythm. It's the only thing that can restart the wiring. Why does this all matter so much? Because knowing the difference empowers you to take the right action. Starting CPR within seconds of a cardiac arrest can double or even triple a person's chance of survival. Think about it. Your heart beats around 100,000 times a day, every day, without you ever having to ask. It's the rhythm of your life. Protecting that rhythm, for yourself and for others, is one of the most powerful things you can do. Learning CPR, knowing how to spot the signs, and having the courage to act. These aren't just skills. They're how we keep the music playing. Don't be a bystander, be a lifesaver.